Hello, it's my great privilege to come over here at Durgapur Mission Hospital, and I'm privileged to talk with Dr. Satyajit Bose, one of the fifth greatest cardiosurgeon in India, and myself as the social activist during the 35 years. I'm serving the society for the common health, common good, and for the development of the society. It's my great privilege also to have the time to have some bites from Dr. Satyajit Bose, who will be giving me idea how we can reach to the public society in more effective way, since we are working only for water, sanitation, public normal primary health care, etc., etc. But how it can be more effective way, I would like to ask Dr. Bose, could you please give me your advice?
The basic idea is to give equitable health to all the population across the country. To get this equitable healthcare, by the word equitable, I means equal quality of healthcare for the rich and poor alike. To get this to this place, we need a lot of alignment in this society. The first thing is that for the government to give all kinds of healthcare across the population, across the country is a very difficult job because it's a very populous country. And and also the amount of money that has been allotted for health as a percentage of the GDP is not more than 2 to 3%. So as a result of which, the permeation of that money, the percolation of that money to each and every person is difficult. And in all comes so government should actually concentrate on primary and secondary healthcare only. And as a matter of fact, to give good primary and secondary healthcare in the areas in which you are working is proper sanitation, to give potable water and all of that. So that is important to prevent many infectious disease related problems, which was one of the main killers post independence. So having taken care of that in this present government and before, is that they have been able to give potable water to a large section of society, and so this communicable disease thing has come down to a great extent. And many other diseases like smallpox, polio and all these things are gradually getting exterminated from the country. But the primary focus should be on the primary and secondary healthcare. And what is more important is that this decentralization should happen in healthcare. People should not rush to larger centers or larger cities for small ailments. So they should be able to treat that in their own doorstep. Now, coming to this situation where better secondary or tertiary or quaternary healthcare is delivered to people, so we must at the same time decentralized healthcare. Say like Eastern India, till about 15 years ago, everything was centered around Calcutta. People living in the districts or even in Jharkhand or for adjoining states and countries, people had to rush to Calcutta to get even treated for a secondary a sepsis or something as simple as a dialysis or something like that. So we need to decentralize that healthcare, and it may not be possible for the government to give tertiary level or quaternary level healthcare at every district headquarters or districts, cities like Durgapur or Burnpur or some places like that. So we need a very good public and private partnership. For a good public private partnership to take place, there must be good participation from the government in giving leasehold land or lease free land to the private players at a cheap rate, give uninterrupted power supply, water and other things at a cheap rate, because and then the private player can make that hospital and treat patients based on rates that are fixed by the government but are sponsored by the government as a part of the larger insurance process, like we have in Ayushman Bharat from the central government, we have the Swasthya Sathi from West Bengal government, and many state governments have different kinds of schemes across the country. So that for the people of that particular geographical area to access this kind of healthcare, we need a very good public-private partnership, and government should decide on favorable packages or favorable rates with the private players so that they are sustainable. So, in other words, to if you ask me to sum it up, healthcare to be equitable has to be accessible, it has to be affordable, and for the private party it has to be a sustainable business model so that they can continue working and not live on doles. So therefore what will happen is there will be more and more doctors required to go to the periphery and go to smaller cities, like we have all shifted from Calcutta to a smaller place called Durgapur, and then now Durgapur has become a health hub. So that way, if we went to say a bigger city than Durgapur, Siliguri does not have so many hospitals, or maybe Dhanbad, which is bigger than Durgapur, does not have so many hospitals. But Durgapur has 16 cath labs to beat it all. So there are a lot of patients coming in from all around coming to this Durgapur. So what if we can have these kind of models can be developed? We are not a public-private partnership, but to make this scalable, you have to have these kind of partnerships where the infrastructure and the water and the land and the electricity, uninterrupted power supply, has to be given by the government at reasonable rates, and the post when the procedure is done, the payments are done at reasonably good time so that the money keeps on rotating, and both parties are at a win-win situation, and the biggest winner is the population of India, who will get primary, secondary, tertiary, quaternary, all kinds of care at their doorstep. I think in a nutshell, this is basically the way in which we can work around.
Yeah. And finally, if I ask you, as Red Cross Society, you know the what Red Cross Society is doing throughout the world, not only in India. So, how it would be more effective? Which particular scheme or program Red Cross Society can undertake, and public will be benefited?
So, I mean, there are many pain points in society in today's day and life. There is a lot of work to be done to improve the infant mortality rate, to improve work on maternal mortality rates, to work on communicable diseases, and to, you know, for all these to be, to make it sustainable, you must also give good, potable water across everywhere, and arrange for vaccination so that there is no communicable diseases. So all these things are very important. So I think Red Cross is already working towards a lot of these things, but I think we must concentrate on blindness. We must also concentrate on, these are all preventable diseases. And then after you are able to treat these communicable diseases, what you can now next go in for is the non-communicable diseases. Awareness sessions, like, where in people today, a large population of people are dying of heart attack at a young age, large population of people are having cancer, and these are mostly attributable to habits, or things like habit forming disease, like what do you call that, these diseases can be modified by things like stopping smoking, not taking alcohol, or even certain changes in diet and all of these things. You can actually work in these areas at a later stage, but primarily to, what India has done a great job. Meaning, when we got independent, the average expectancy of life was 47, 46, or 45, but now it has gone up to 68. The aim is to get a average expectancy of life at least till 80, like in advanced countries. India, you see, there's a big problem. India is basically a young population. By another 30 years, India will have a very aging population, and there'll be a lot of health requirements for septuagenarians, octogenarians, and nonagenarians if they live till 90. But if they are able to do good lifestyle modification, then they can prevent all these non-communicable diseases to be less prevalent, and people can actually remain healthy till a long time.
So, Dr. Bose, I'm really happy and very much grateful for this type of bites. And finally, I would like to request you to give us specific idea or specific advice how Red Cross Society can directly help and go to the common people.
So as an organization, I think there is a huge I would say a disruption that is taking place. Is that you can instead of human beings going up to the doorstep with the so many people having these modern mobile phones becoming cheaper and more available, you can do a lot of app based or handheld device based screening procedures, like looking for anemia, looking for blood sugar, diabetes, or even for that matter having ECG spectrum, so that people can identify ECG disturbances from the watch or from the mobile. And then there can be somebody sitting in the middle of nowhere and identifying which person is having which kind of disease, and do a mass screening procedure. So I mean, this is just one way, and there are several other ways in which it is more HR intensive, and people can go around and screen for communicable diseases, and also non-communicable diseases like CA breast, for congenital heart diseases, for so many other things.
Okay. So thank you very much, Dr. Bose, and for your valuable time given for us. And it would be really helpful for the community, for the people at large.
Thank you
Thank you
very
very
much.
much.
Thank you.
Namaskar.
Namaskar. Namaskar.